Hi, this is Colleen Parsons with Part 2 of Abdominal Assessment for Health Assessment. Your subjective data is very important, as it is with all assessments. Appetite, dysphagia, food intolerance. What can your patient eat? What have they been eating? So you can begin to see how nutritional assessment works hand in hand with your abdominal assessment. What are their bowel habits, past abdominal history, any surgeries, any diagnoses such as Crohn's disease or celiac disease. So what is actually going on for the patients? What medications are they on? Opioids especially will inhibit peristalsis, so that constipation becomes a real problem. Other medications cause diarrhea as a side effect. So pay attention to what's going on. So your subjective data questions are listed here, and you want to pay attention. How is somebody's appetite? How have they been eating? And really listen, has there been a change in the last year? Has there been a change in the last 6 months? Have you gained or lost any weight over the last 6 months to a year? Were you intentionally trying to lose weight? Dysphagia. Do you have any difficulty swallowing? When did that first begin? What causes it? Have you noticed anything that causes you to have more discomfort swallowing than anything else? Food intolerance. Is there anything that you can't eat? Is there anything that causes you significant heartburn, belching, bloating, or indigestion in any other way? Do you use antacids? How often? And what about abdominal pain or discomfort? Asking them to point to where their pain and discomfort is important. How did it start? How long have they had it? Does it go away when they eat? Does it occur before or after meals? Does it get worse and then go away? Is it cramping, burning, dull, stabbing, aching? Exactly what does it feel like? And is it relieved by food, or is eating making it worse? If pain is associated with a menstrual cycle, then you want to really pay attention to that aspect and what is actually going on for that patient. Is there any fatigue, nausea, vomiting associated with that? Is there any vaginal discharge? And if it's a man, is there any penile discharge going on? What makes the pain worse? What makes it better? Any nausea or vomiting? If so, how often? What color is the emesis? Is there any specific odor to the emesis? Is it bloody? Does it have coffee grounds in it? What are some of the elements that they're seeing in their emesis? Is nausea and vomiting associated with a colicky pain, diarrhea, fever, chills? What foods did they eat in the last 24 hours? If you're guessing this might be a food poisoning, you're going to go, did you eat in the last 24 hours at home, at school, in a restaurant? What's going on? Bowel habits are very important to be asking your patients, and especially the use of laxatives. If they're using laxatives, how often do they use them? And if your patient is on a magnesium supplement, that might also act as a laxative for them. So they might be taking too much magnesium for themselves. That is a muscle relaxant, and that can cause diarrhea. There's milk of magnesia. There's magnesium in milk of magnesia, which is it relieves constipation. So any other history of gastrointestinal problems such as ulcer, gallbladder disease, hepatitis or jaundice, appendicitis, colitis or hernia, anything like that that's going on. Medications. What medications are you currently taking? How much alcohol do you drink each day, each week? When was your last alcoholic drink, and what was it? Not just how much are you drinking, but how much are you drinking of what? Do you smoke? How many packs a day? For how long? Of course, we're thinking about cancer along with that. Nutritional assessment. And then, again, ask about your diet. You remember how to do your nutritional assessment? And then for infants and children, are you breastfeeding, bottle feeding? And how is the infant tolerating any new foods? Are you seeing any problems with that? How much water and juice is your child drinking? Does constipation seem to be associated with toilet training? What have you tried to treat the constipation if the child's problem is constipation? Additional history for infants is if the child is overweight, how long has weight been a problem and what are you doing about it? What kinds of foods is the patient eating? But it's not unusual for some parents to feel that the child has an obesity problem when the child really doesn't have an obesity problem at all. So make sure that they're within their optimal growth and development according to the charts before you start talking about an overweight child. Additional history for adolescents. Adolescents like to snack a lot and they don't like to eat breakfast in the morning. So try to get as much of a history as you can. My experience with adolescents is they don't always tell you about the snacks because they don't want you to know. So how tired do they feel? If they're feeling really tired, often that is nutritional deficiency. They're not eating well. So are they tired, hungry? What do you think? How do you think your body looks? How is menstruation? So we're looking for overeating, we're looking for nutritional balance, and we're looking for undereating, things like bulimia and anorexia. Let's see, aging adults, they're going to have more difficulty with constipation. Everything slows down a bit. They don't eat as much, or they're eating as much, maybe not eating high quality foods. How often do their bowels move? Have there been any changes? Are they getting enough to drink? Actual water, fluids to drink. And that's the end of part 2.